Hi, Julia. Thank you so much. I didn't know you were scheduled in the waiting room. Oh, you are muted.
Sorry, that's where the link took me. So,
No,
yeah,
no problem. Well, I will just give a brief introduction and then we'll get started with the presentation. And Julia, did you want questions during the presentation or after?
probably just after would be great.
Okay.
Um, you don't have any video, or not that I can see anyway, just so you know. I'm not sure.
Yeah, no, I don't
Okay.
have any
Okay.
video.
Oh, no problem. Okay. Just wanted to make sure.
Yes. Thank you so much, Julia, for for taking time to speak with our group today. For
Absolutely.
everyone who is new here, I have Julia Wood from the Lewy Body Dementia Association. She's the Director of Professional and Community Education, and we'll be talking today about Lewy Body Dementia and the overall vision for the disease. And my name is Nina Davis. I'm with Inside Memory Care. I will provide our information in the chat box for later on after the presentation. And of course, Julia will provide her contact information afterwards. In that case, I will hand it over to you, Julia. Thank you so much.
Perfect. Thank you. So, I'm going to go ahead and share my screen, you guys. So, hopefully, you can see my slide presentation. All right. So, let me get this set up here for a second. Okay. So, welcome everyone. So, my name's Julia Wood, as she mentioned. I'm the Director of Professional and Community Education at the Lewy Body Dementia Association. We are a 501c3 national nonprofit dedicated to advancing support, research, and education for families living with Lewy Body Dementia. And today I'm going to be talking to you about a little known and I think kind of hidden disability and symptom within Lewy body dementia, which are changes to vision. And a lot of people are not aware of these changes, of what they can look like. It's something that really separates Alzheimer's dementia from Lewy body dementia. And it's something that a lot of times people aren't aware of, that they're even having these changes. And maybe family members and care partners aren't even aware as well. So, some takeaways that we're going to focus on today is how to really optimize the environment. So much of what we see is dictated by lighting, by color contrast, by having our spaces simplified so that we can reduce any visual confusion and enhance safety. And we'll talk about how that all works. And then looking at some effective visual aids. So, there are some things out there that we can use, some tools and strategies and techniques that can help manage these visual impairments and support people living with Lewy in their daily activities. And then lastly, I'll touch on visual hallucinations, a little different than the visual symptoms that we see, but it's something we get a lot of questions about, and a lot of people are really confused of how to handle these. So I thought I would throw in a little bit of content on that as well. So, when we're talking about vision in Lewy body dementia, we're talking about not just the eye. And I think that's the important takeaway today. One of the key ones is so much of our vision actually happens in the brain. So, we're really talking about not just the mechanical part of vision where we see through our eyeballs, but also that processing part that once that signal goes in, how that gets to the brain and how that information is then interpreted. So, vision impacts absolutely everything. And this is something I've been really familiar with my whole life. I have some pretty significant visual impairments. And, it really does until I got a lot of my vision corrected. And that took a while for technology to catch up, even with like depth perception and things. It impacted a lot of my daily functions. And I think one of those that we want to think about is driving. Right. So when we're talking about visuospatial function, which we'll talk about in a little bit, how you kind of your brain understands where you are in space, that can impact how we negotiate traffic lanes, right? Parking, judging distance of our vehicle from another vehicle, or maybe within a parking space or trying to parallel park. Of course, vision can really impact those simple daily activities too, like getting dressed. So, is it a black sock and a navy sock or two navy socks? Doing grooming tasks. So, sometimes shaving, I had a woman one time, unfortunately, with Louie, that she came in one day and she had put her eyeliner on her lips and her lip liner on her eyes. So even things like applying makeup, of course, mobility around the home, really being able to navigate your environment safely is a really big, important thing to talk about today as well. And then those more complex daily activities like cooking or bill pay or home management. And a lot of times, anything that involves reading can be impacted by this as well. So, lots to kind of think about. And I think as we're talking through this symptom today and how this presents, I want you to kind of process and think, or there may be some things in your day that are being impacted by vision, or maybe your loved one's vision that, you guys aren't aware of. So I just want to review this because there's a lot of confusion around what Lewy body dementia is. When we're talking about Lewy body dementia, we are talking about both Parkinson's disease dementia, and that is someone's had established Parkinson's disease, right? A diagnosis, they've had movement symptoms for at least 1 year. That's the 1 year rule. And then we know as time goes on, estimates suggest around 50 to 80% of people with Parkinson's will go on to develop dementia. And so that's considered Parkinson's disease dementia, or PDD. So if you think about it like a chicken or an egg, the Parkinson's came first. In the case of dementia with Lewy bodies, the dementia comes first, or at the same time within that first year of diagnosis. And so they're either getting the dementia and then later on the movement symptoms happen, or the dementia and the movement symptoms happen at the same time. And interesting to note that for a small percentage of people, some people with dementia with Lewy bodies never develop much Parkinsonism, or those movement changes that we typically think of with Parkinson's disease. It tends to be more cognitive changes and visual changes, hallucinations, things like that. So this is one of my favorite graphs. My coordinator laughs that I will probably have this engraved on my tombstone, and I might. But what I love about this graph is, pictures say so much more than words often. These two graphs, the top graph were neuropsychiatric tests. So these are all neuropsychological batteries that look at memory, language, attention and executive function, visuospatial function. And the top graph, those were all completed by people with Alzheimer's disease and confirmed Alzheimer's dementia. On the bottom, these are folks with dementia with Lewy bodies who completed the same test. So here I'm going to walk you through it. Over on the far left side, you notice this black bar, this one single black bar, and how both of them, it goes up to the 6. That is a global rating of dementia that we call the dementia rating scale. You'll notice that's the same for both, right? So this is like if you went into your primary provider and they do just a quick screen, like a Montreal cognitive assessment or a dementia rating scale. If that's as far as you get with testing, a lot of times this is where the misdiagnosis for dementia with Lewy bodies happens because it looks the same. But now that's where the similarity ends. I want you to look at these red bars, these green bars, these yellow bars and blue bars, and you can put it in the chat if you want to me, or you can just think it to yourself. Are they similar? Are they different? Or are they opposite? So they're really opposite. Look at up here, if we're looking, these red bars are memory. Look how low those scores are for somebody with Alzheimer's disease. And look how much higher those scores are for somebody with dementia with Lewy bodies. We move over to language, you'll notice there's some language impairments going on for both, but they're completely different. The tests that the folks with Lewy are stronger on are lower for Alzheimer's, and vice versa. Moving over to these yellow bars, those are measures or tests of attention and executive function. So being able to attend to things, being able to follow a task that has multiple steps. And you notice how much higher these scores are up here for somebody with Alzheimer's compared to somebody down here with Lewy. And now what can happen is if you're not paying attention to something, you won't remember it. If I tell you my name and you were doing something else or thinking about something else and you don't remember it, it's not necessarily of a memory impairment. You weren't attending. So this is where you may see some changes in working memory for people with dementia with Lewy bodies, not that long-term memory shift like we see with Alzheimer's, but more in that day-to-day aspect. So then these blue bars, this is why we're all here today. We're gathered together is to talk about these visuospatial changes. Look up here at Alzheimer's. These tests, they scored really high. They did really well. Down here with Lewy, those scores are really low. And so this is really where, a lot of times some people believe that dementia with Lewy bodies is a type of Alzheimer's or it's the same. They're completely, utterly different when you're really engaging and interacting, especially in how they're processing information and processing the world. All right. So when we talk about vision and LBD, what happens is Lewy body dementia impacts the visual system by interfering with the ability to process that visual information coming in and respond to that information. And so these signs and symptoms often occur very early in the disease, but what we find is people often don't really note them or recognize them until much later on. And then visual hallucinations, which we'll talk about early or later on in this presentation, occur early and they persist throughout the disease. Now, that doesn't mean every person with Lewy will get hallucinations. That's kind of the problem. Every person with Lewy doesn't necessarily get anything. They have a very unique, often individual presentation of their symptoms and what's most bothersome. So, a little polling question here, and you can just type your answer in the chat if you're so inclined. But I'm just kind of wondering if we're care partners, if you're a person with Lewy, whoever's joining us, have you noticed these changes to vision? Are you aware of them? And you can say yes or no, or you're not quite sure. And this kind of lets me know where our audience is a little bit. So I'll see if you guys are talking to me. It's okay if you don't. Sometimes people don't want to chat, and that's okay. All right, you guys are silent but deadly. Here we go. I'm teasing. That's totally fine. I'll check it again in a minute. So, as we know, we saw that link up earlier, right, with Parkinson's. So, Parkinson's disease and Lewy body dementia, these are all Lewy body diseases, right? So, people with Parkinson's disease have those Lewy bodies in their brain. People with dementia with Lewy bodies do. So, we see a lot of overlap, but as you can imagine, a lot more research in Parkinson's than in dementia with Lewy bodies. So changes that we see with Parkinson's, there are changes to eye movement. So being able to track with the eyes, like with reading, or maybe look at something on the screen and then maybe you're writing notes and then look back up and find that spot. So some changes that way. Color perception can become impaired. And this isn't like color blindness per se, but more like things get muted. The contrast isn't as sharp. So perceiving color can be more difficult. And that's related in a lot of ways to the loss of dopamine that we see in the brain with Parkinson's. And dopamine is part of our color vision system. So I already mentioned that decreased contrast sensitivity. So being able to, tell navy from black or things that maybe don't have a lot of contrast, seeing that apart. We also see impaired visual processing. So this can be in figure ground. So that's seeing your keys laying on the table, right? Seeing the figure from the background. And then also in depth perception. So maybe stepping down from a curve, being able to judge how deep that distance is. We also see impaired recognition of motion. So my dear friend with Parkinson's disease dementia will sometimes think that an object that's static or sitting there is moving. This also relates to being able to read emotion. So, a lot of people with Lewy body dementia have trouble reading emotion on people's faces or even sometimes recognizing faces. We see impairments in peripheral vision, and that kind of relates somewhat to some of that eye movement too. So, seeing things a little bit more out of the central line of vision. And what's interesting is if the person has on off fluctuation. So that means when your meds go off, if you're on those dopaminergic medications for Parkinson's, then this can really impact vision. My dear friend with Parkinson's disease dementia, when his meds go off, he said everything comes in on him. So the table that was 10 feet away now feels like it's blocking him from moving. And as you can imagine, this can also relate to changes to how someone walks or their gait, and also postural instability, which relates to balance and falls. So if someone's having a lot of these visual issues, a lot of times they're starting to have more changes with safety in their mobility as well. So, just a little geek out moment here. We're not going to get too much into the anatomy, but I just wanted you to see how complex the musculature of the eyeball is. I mean, look at this. We've got a whole group of muscles that surround the eye and help to coordinate those movements. Well, if you think about Parkinsonism, those motor changes we see related to Parkinson's and Lewy, that impacts motor coordination and movement. And so this can, of course, impact visual tracking when you're reading and scanning. Unfortunately, it can often result in double vision. So somebody might start to see two of things, or vision gets really blurry. And as we talked about earlier, we have that risk of instability and falls, but this can also be maybe tripping over something that's in your pathway because you're not able to scan the environment so well. So keeping that environment really clean and clutter-free and widening spaces for movement can be really helpful. So, convergence insufficiency is something that happens a lot related to these movement changes where the eyes have difficulty moving toward each other. And so it makes it really difficult for people to be able to read or do fine work without seeing kind of a blur. And there is a treatment for this. If it's causing problems, your eye care provider can sometimes add prisms to your reading lenses to help improve your near vision. And, eye movements can often impact the ability to use a multifocal lens. So, this is something that you want to think about. If you've got progressives or bifocals, sometimes those might not be the best lens for somebody with Lewy because their eye has a hard time readjusting and resetting around that lens. And it's really important, you guys. This is one thing I'll kind of hammer on a little bit today. You want to seek out proper lenses as soon as visual symptoms become evident. If you're seeing changes to reading, changes to being able to focus at different distances, you may need to see also a neuro-ophthalmologist or an ophthalmologist instead of an optometrist. Sometimes they have a little bit more awareness of these issues related to someone's neurological condition. Another thing to really be aware of is because these, movement symptoms are happening, we see reduced blink rate. So people start to blink less. And then this can contribute to dry eye. So we'll see some dryness of the cornea, and that can cause some visual blurring or even double vision. So it's not always convergence insufficiency as to why we're getting that blurriness. It might be that we need a little lubrication in the eye. So this can be handled really easily, right? So artificial tears, especially those without preservatives, can help keep the moisture level adequate. Keeping a humidifier in your home if you're in a drier climate and staying hydrated. I'm going to be saying that one a lot too. Drinking that water is important to maintain a good tear film. And then keeping eyelids free of debris. So there are little lid scrubs that you can get to kind of help keep the oil glands free from dysfunction, but that's something to definitely discuss with your eye provider. And then you want to also ask if there are any of your medications that could be increasing dryness in the eye. And that's not necessarily your medications for Lewy, that could be other types of medications that you're taking for other conditions. So this vision in the brain piece to really kind of bring it full circle too, 25% of our brain is dedicated to processing vision. That's a lot. And then another 25% is dedicated to interacting with those visual regions to help us recognize people, to create memories, to perform tasks, to find our way, to remain safe. So we've got like half of our brain working on our vision. And so when we're having a brain disease like Lewy body dementia that impacts a lot of these areas, it's very understandable why this is happening. Once again, not going to give you an anatomy lecture. I just know for a lot of people, seeing pictures really helps, but these are all different parts of the brain. You'll notice that it's showing are related to vision. In the front, we've got the blue part. We're looking at the frontal eye fields. You notice how there's that neuron, those oculomotor neurons coming from the eye and going into the brain. And then it comes into these gaze centers. And then it's going into all different parts of the brain to help us spatially recognize where we are, have depth and color form. So a lot of our brain is working really hard just to help us see. So, how do we identify this visual brain dysfunction? It's not going to be part of a routine eye exam. And in fact, someone could have 20/20 vision and have visual brain dysfunction. So this is going to require some specialized testing and assessments that are typically administered by a neurologist, a neuropsychologist, or like I said, a neuro-ophthalmologist. And it also can be screened a lot of times by occupational therapists that can do some visual assessments and kind of look at what's going on with your visual processing. And like I said, it's really an invisible symptom, right? So over here on the left, we're seeing that box in 3D, but for them, because of that depth perception, it may look more flat. We're seeing those red berries on that green bush because we can see that color contrast, but that can become really muted for them. And then with that peripheral vision, it may look like around that image is almost kind of blurred out and they can really more centrally focus. And then that double vision on the bottom, we gave you an example there of what text looks like if they're trying to read and they have double vision. So this is just something really, really to be aware of, is how different their visual experience might be from our visual experience. So we're talking about prescription lenses. You definitely want to let your eye provider know that you have Lewy body dementia and that it can impact the ability to use certain lenses. So like we said, those progressive lenses, trifocals, bifocals, because those are going to require those little tiny eye movements and adjustments of neck position to get everything all aligned. And it's also important to note that you may have some oculomotor slowing. So it's just that scanning and adjustment and focus is happening much more slowly. And so that can even make those multifocal lenses more difficult to use. So, little caveat here, make sure it is important. And in fact, they've talked about correcting hearing, right, with dementia. So important. And I know you guys, you probably have a ton of medical appointments, but keeping your eyes as healthy as possible, making sure prescription lenses are up to date. So important. And then you want to schedule those annual visits to the ophthalmologist, even if you think your glasses are the right prescription, because changes can occur inside the eye before you might notice that. So we want to keep up to date and follow the recommendations for that. All right, so let's talk about these cognitive changes in vision. And these are really unique to the individual, but there's some patterns we see, right? So there was a study here done by my colleague from Penn, Ali Hamidani, and his colleague that looked at vision-related cognitive deficits in Lewy body dementia. And they found color discrimination, like we talked about earlier, and contrast sensitivity to really be a problem. Object and form recognition, so being able to recognize what the object or the form is. And that can sometimes relate into what we call illusions, where a coat hanging on a coat rack might look like a person standing there. Like I said, we talked about those visuospatial impairments. We're going to get into that a little bit more. Even what we call visual anagnosia, where they don't really recognize what they can't see, can have some pareidoia, so difficulty making out a scene from kind of the noise in the background, right? And then also some visuoconstructural impairment. So if you've ever done that one test where you have to draw the figures, trying to copy a figure, or even maybe trying to copy text can become problematic. And then visual search impairment. So trying to search through some text and find the point that you're looking for, or find the object on the desk that you're looking for, can become a real issue. So I gave some examples here. So you can see one of those tests there on the left-hand corner for color discrimination. And I'm not sure if you can see those forms in the color that are in there, but that's one of the tests that they use. In the center, a little bit more center here, we have a desk with a bunch of objects on it. And this is kind of showing that object form recognition of being able to really look in that cluttered environment and see those different objects and make out what they are and identify them. And then at the bottom, you see a little bit of the pareidoia test. I'm not sure if you guys can see some of the shapes that are in there. There's a face in one of them. I'm not sure if you can make that out. So these are some of the tests that they'll do sometimes. And actually, two tests: pareidoia and color discrimination, object form recognition. I wanted this to be a little bit more of an example of what that meant, because that's kind of a squirrely term. So, does this look familiar in your homes at all? So, I want us to look at this. I'm embarrassed to say this is actually my bathroom cabinet. So, I live in Philadelphia and I call it the land of the tiny toilet. We have the smallest bathrooms on the planet here. And so you can see how the back of my bathroom cabinet is mirrored. So now look how you can see the toilet in the mirror. So think about this from the perspective of the things we've talked about. If my husband or if I had Lewy body dementia, it's way too cluttered. Like I'm never going to be able to find the object I'm looking for and get that out of there. So this is something to really think about, how we're organizing spaces as we start to move into talking about environment. Do you think this would cause difficulty if you had LBD? I'm pretty certain it would. And you can tell too, the inside of the door is mirrored. So then you're seeing the inside of our shower. So now it's hard to tell what is where, and it's just a lot of clutter. So getting into visuospatial function, what we mean by this is our ability to provide a spatial map of our environment. It tells us where things are around us and also involves a sense of direction. So going from your recliner to the bathroom or navigating your community when you're walking. So some things that we see very commonly in daily life for people with Lewy, I've dealt with this all the time. I didn't introduce myself and let you know I'm an occupational therapist and was for many years at the University of Pennsylvania's Parkinson's and Movement Disorders Center. And all the time I had people that were breaking coffee cups or, breaking items because they would set, a coffee cup or a glass too close to the edge of a table or a surface, and then it would fall off and break. Sometimes people might think items are closer to them than they are. Like my friend I talked about with the coffee table, that he'd be like, I can't get up from this chair because that table 10 feet away is in my way. Sometimes people may bump into furniture or walls, and this can cause some injury or falls. Have you ever seen when they go to the chair and the arm goes out first? And so they're, having trouble estimating how far that chair is when they're approaching to sit down. We already talked about the distance judgment when we're driving, and then thinking about, navigating your home and also your community with this. So this can be really, really challenging. So I wanted to show an example here. These are actual clock drawings from some of my patients over the years that I was fascinated by. So clock drawing is a really big test of this. So you can see all the different configurations we've got there. And it's important to note that visual spatial changes are really, they're independent of your visual acuity. And if you have a lot of fatigue or things like that, that can make them worse. And then we talked about earlier how this is really where we get into some of those issues with like planning how you're going to move or planning your route when you're moving. Fog is freezing of gait. So if you have that incident where your feet feel stuck when you try to walk, this can relate in. And then also the postural instability, which can lead to balance challenges and falls. So some strategies to support visuospatial function, you want to really think about contrast in your environment. And we're going to talk about that. I'm going to show you some visual examples. Want to think about where can you provide a visual target. So like if they're sitting in that coffee cup next to them on the table, maybe a bright colored coaster, right? Or maybe the mug itself is like bright red, having a placemat. I had a gentleman one time that all he wanted to do was unload the dishwasher to help out his family, and he kept missing the counter and breaking things. We went to using these bright colored placemats, and he would set all the dishes on that. And then we put some shelf liner in his cabinets that was bright colored so he could see that he was getting that dish all the way in the cabinet. You can think about using some colored tape. I mean, they have duct tape now in every color imaginable, and you can put that, at the edge of a stair or on their cell phone so they can find it. But you can also use decorations. I'll show in a little bit how just furniture, pillows, and blankets and throws and things like that can help create some contrast. Then you want to really look at lighting in your home. If it's really dim and I learned this the hard way. My friend with Parkinson's would come over, and I'm a very ambient lighting kind of girl. I like art glass a lot. I love, my lights are kind of dim in my home. We burn candles, and he couldn't find his way around. So when he would come over, we had to really kind of turn up the lights and have it a little bit more visually appropriate. And then we also want to minimize clutter because part of our vision is attention. And if there's a lot of things distracting us, that's going to make a problem too. And that's where we're going next. So, when we talk about attention, these are our mental processes that enable us to selectively concentrate on a specific stimuli or a task while we filter out those distractions. And it's really essential. Attention is the mother of all cognitive domains. Without it, we can't learn if you're not paying attention, right? You can't remember something. You can't complete tasks or steps if you're not attending to what you've done and what's next. So, this is where I think a lot of the cognitive issues we see come into play. So, what challenges our attention? Thinking about it right now, even maybe there's sights or sounds or distractions in your environment. Maybe there's decreased contrast sensitivity going on. Maybe multitasking. That's a real challenge for attention. If you're going back and forth, that slower processing speed that we see, we call that bradyphrenia with Parkinson's and Lewy, where everything just kind of goes a little slower. And then even the slower movement. So maybe we're having to focus and shift our visual attention or change our position. And so that slower movement can make this harder. We sometimes see reduced hearing sensitivity, not necessarily because of Lewy, but even as we're aging. And that could be a challenge for attention. Impaired visual scanning, these cognitive fluctuations where someone might be really alert one moment and feel really confused and kind of disoriented the next. And I mentioned those cluttered environments. Everything in your environment is competing in your brain for what you should attend to. So, something to remember. So, some strategies here. Number one, reduce the distractions. The more clutter-free, simplified you can keep your organizations, your spaces, the more organized you can have things, the better. Really help to limit that focus and avoid multitasking. It's the enemy of people with Lewy and with Parkinson's, one thing at a time. We want to also think about taking some breaks because we all kind of overestimate our attention. Even this, hour-long session today, that's a long time to pay attention. So taking a brain break, increasing contrast, which we're going to talk about more in a moment, optimizing lighting, which we'll talk about as well. And then we talked about those visual targets. So someone can kind of see where they need to put whatever item. All right, so let's get into some of these strategies. How can we set someone up for success with this? Well, number one thing I want to give a caveat, not all strategies are going to work for everyone, right? Louie's a moving target. Even if you find a strategy that works today or this week, it might not work next week or work all the time. Louie's also progressive, so the visual needs are going to likely change over time. And we want to assess vision and consistently kind of check in on how these adaptations and strategies are working to keep the best strategy for that person going. So, a lot of times that might be having a really good occupational therapist in your pocket or neuropsychologist, someone who's going to help you figure out how to navigate around these strategies and these challenges that come up. So here's contrast at its most simple. So you can kind of see here with these little squares where, the more opposite really kind of that color is, the more it pops. And you can see it. You can kind of see on these the bad examples of contrast too, right? So we want to think about this when we're thinking about figure ground. So like my friend kept losing his cell phone on his desk. Well, his cell phone was kind of black And his desk was a dark wood, so poof, it was gone. So we got a case and actually we put some, bright colored tape on his phone. Then he could see that because he could see that contrast. We also want to think about this with any printed documents. So if you are, getting printouts from the doctor or printing out any articles or anything to read, trying to have that contrast high is really important. Also, even on your computer, you can set your phone settings, you can set your computer settings to really facilitate more contrast. If we're thinking about reminder signs and even our furniture, having things where we can see it, we kind of all live in a beige world with like hardwood floors or light colored carpet and light colored furniture and walls, and everything just starts to kind of blend in together. So here's some examples that I wanted to share of how to kind of create contrast in your home. So you'll notice on the left-hand side, it's kind of that beige world I was talking about, right? Light colored carpet, light colored table, light colored furniture. So notice the things that pop though, like that black mug. See that a little bit more. Those pillows, with the black stripe kind of gives a little more contrast. I would want more contrast in my environment than just that for somebody with Louis, but it does help. You can kind of see where that plays in. Now compare that over on the right hand side, that bright blue chair, right? With just the gray. You can really see that. And maybe you don't want to go out and buy a new chair, but maybe you could put a pillow in the chair that's a bright color like that, or like a throw, kind of like you see in the other picture. And then if you are considering buying any new furniture, or things like that, thinking about this, keeping this in mind as you're shopping. So when we talk about lighting, bright is not always best, especially like overhead can lights. If you got those suckers cranked up really bright, you'll get a lot of glare. So somewhere between dim and bright is really best for most people. So that's why having like a dimmer switch on a light can be helpful, because then you can kind of adjust up and down. Here's that overhead lighting that I talked about, getting that glare. So we want to really kind of watch out for that. And then you have to kind of experiment because, of course, as your light is changing outside during the day, be it a sunny day, a cloudy day, whatever might be going on, different seasons going from day to evening, that can really impact how much you need the lighting turned up in your home. And even thinking about things, I had a woman one time that had freezing of gate and falls on one side of her bed only, and we're going through everything. I'm like, is there a rug she's maybe tripping over? Is there a flooring change? I'm trying to figure it out. And finally, I was like, wait a minute. What lights do you have on when you're going to bed? And she's like, oh, we just have a lamp on a bedside table. And I'm like, wait, a lamp. And I said, so you only have a lamp on one side of the bed? She's like, yeah. And I was like, which side are you falling on? The one with the lamp or without? What do you think? It's the one without. So she would get over to that side of the bed. There was no light because it was all on the other side of the bed, and she would freeze and she was having falls. Simply putting another table over there and putting a lamp, really helped solve that problem for her. So, some other things to avoid, a big one here: glass top tables. I can't say it enough. I don't know how many patients I've had trip over these and fall into them. Um, they can be very, very dangerous. And I mean, look at that. How are you going to see that if you have visual brain dysfunction? It's just invisible. So this is something. Now, does that mean I don't want everybody to think I'm like, buy all new furniture? You could put a table runner on it so you can really see the contrast. Maybe you put a tablecloth so you see that instead, or coasters. There's things you could do to really let someone see, like, hey, this is here. But if you have the choice of not having these items in your home, I think it's the best way to go. Of course, with what we're talking about with this whole idea of, object form recognition, you know, we hear a lot of times where people can't find things, and you might hear from your husband that, where are my glasses? Where are my keys? Where is my this? So one rule of thumb is I encourage people to place only essential items for everyday use in view, on a counter, on a dresser, in the bathroom, wherever. We want to separate items into organized, task-centric ways and only have things out that we need. Consider adding that brightly colored tape like I talked about if things are difficult to find. An alternative to this is that dimensional fabric paint that you can get at like a craft store where you can put a dot, you can put their name on it in it, you can put anything on it, you could draw a kitty cat, but something where they can see it more. And then I always encourage people, and I live by this rule too. I have an anchor point in every room that if I take my glasses off, my glasses go in that anchor point because if they don't, I can't find them. So having a place, Aunt Anne's candy dish or something to put, keys, the phone, other items get frequently misplaced. So you've got that anchor place to put things. So here's some examples of how you can organize and simplify. So my friend, for example, was having trouble shaving, and his care partner was like, I don't know what to do. He can't. It's like he can't figure out what to do. Well, I went over like all of their bathroom stuff, kind of looks like my bathroom stuff, frankly, like all over the place, everything together. And I said, let's make him a shaving bin. And so we got one of these bins similar to what you see on the left side, and only his shaving items went in it. There's one down at the bottom of the screen that's a nice example too, with just like the razor, the shaving stuff. That's it. And so really think of how can you organize and simplify. Sometimes what I found for people with Louis, the family would think they couldn't do something a lot earlier and they could actually do it. They just needed it set up a little differently. The thing with executive function is a lot of times initiating that task. Well, if there's a lot of clutter, disorganization, you're not sure where to start, that definitely doesn't set somebody up for success. So, some different things about navigating the home. We want it well lit, right, to minimize those shadows. We want to use that contrast so they can really see. Maybe we need an arrow, a sign with a little arrow on it pointing to the bathroom or to the room or the refrigerator that they can't find. And you want to think about where their gaze level is. Typically, for folks with dementia, a lot of times the gaze level starts to lower. So you don't want to have it up high if maybe they're where they're really scanning and looking is a little bit lower. So thinking about that. Look at some creative ways to highlight certain rooms, and I'll give you some examples of that. Create some unique pathways. I did this with some people where we take different types of tape, and we had the yellow brick road that went to the bathroom, or green meant we were going to the kitchen. So sometimes things like that can help. Just make sure you don't create a tripping hazard in putting tape or anything on the floor. And then, of course, I'm going to show where that contrasting tape on the edge of a stair is very common. When we're out, we see that bright yellow thing in a lot of businesses, and that's for safety with stairs and with steps. And then I put a little note down here, really, really, if you don't have a physical and an occupational therapist in your care team that are familiar with Louis and can help you determine how to kind of modify your home or adapt things, get the right gate device, I really encourage you to do so. Absolutely necessary. So here's some ideas, and you'll notice up in the top left, there's those colored tape lines that I talked about. This is in like some store. I just found the picture online, but you can do that in the home. Painting a door frame a bright color so that they recognize then where that entrance or exit point is to where they're trying to go. These taped lines over here, you guys, on the floor are that approach to sit when somebody's trying to get to the chair and they're not sure if they're there. So now X marks the spot. We want to get our feet where those X's are. The bottom left-hand corner, this was actually a visual reminder for this patient to slow down. Not everyone with Parkinson's is slow. She was very speedy. She had Parkinson's disease dementia. And so she had a lot of falls because of that. And so for her, she was Mandarin speaking Chinese. The turtle reminded her to be slower. And so she actually picked that out and she wanted it on every walker, on everything she had. She even bought a little crystal turtle. And then on the bottom right-hand corner of your screen, you'll notice that bright yellow tape at the edge of the stair that helps with that stair negotiation. So getting dressed is an area a lot of times where I feel like people think someone needs help before sometimes they do. And one of the simplest things you can do is to really organize your closet into sections and take out any clutter, any clothing that doesn't need to be there. So maybe you've got a section for shirts and tops, and then you've got a section for pants, and then maybe a section for accessories. Another thing I found sometimes worked for a lot of my people was putting outfits, a whole outfit on a hanger. And so we would even sometimes have them take like a lingerie bag, or like those wash bags or a Ziploc bag to even put underwear and socks and things in. So when they got that hanger out, they had everything they needed to get dressed. Think about organizing drawers in a similar manner. So if you've got places, where you're keeping clothing in a dresser drawer, think about the same thing. Sometimes, if all the drawers are the same, like my friend with Parkinson's dementia moved into this place that they had kind of like these built-in drawer things, and there were probably 40 drawers, and every drawer looked the same. I would have gotten confused. I wouldn't have been able to find my own underpants. And so, what was interesting is a lot of times with dementia, we talk about putting like an icon. Like, I think I took a sock icon and just a picture of it and put it on the drawer. He looked like a telephone receiver. So I was like, okay, well, visually that sure didn't work out. So then I took a picture of the inside of his drawer and I put it on the outside of the drawer, and it worked because then he'd see that picture and go, oh, this is the drawer where my underwear are. You can use that labeling in any room. Once you find what works, you can use that in the kitchen, you can use it in the bathroom. But, for him, it's like he has a picture basically of what's on the inside of something that's closed on the outside, so he can figure that out. And then a big one here is really simplify, simplify, simplify. If there are a lot of clothes they don't wear frequently, things that, are out of season, if you can, maybe put those in storage, get those out of the way so they're not competing for that attention. Reading can be another problem. So, considering large print with a strong contrast, and sometimes you can order large print books. You can take documents and increase the contrast by making the font bold. So, there's a lot of things you can do that way. Clear any items away from the surface where you're reading. If you're reading a book and you've got a pile of stuff all over the table in front of you, your brain is going to be figuring out which one to pay attention to. Something that's not so intuitive, but glossy pages, like magazine pages that are really glossy, can get a lot of glare and be very difficult to read. Using a ruler or a bookmark or a line magnifier can a lot of times help someone scan and move from one line of text to another. Another thing that can be really hard is like the newspaper. So if you think about the front page of the newspaper, how it's got a lot of different sections and paragraphs, and like you finish here, but then you got to go to page 7, that can be really confusing. So I had a lot of people that I had them get like the online version of their newspaper, and we would print out articles that they wanted to read. So they weren't trying to navigate all of those different pages. Um, Consider audiobooks. If you're somebody who really enjoys reading, even if it's a break, I've had people that will read, say, a chapter and then listen to a chapter, just to kind of have a little bit of a brain break. One of my favorite hacks is a book light. The more you can have that light directly over the book, as long as the pages aren't glossy, it really helps with vision so much when you're reading. So here's some examples. So it's a book light there on the left-hand side. And you can find these, they'll clip right on the book. They're very low tech. They're usually pretty inexpensive. The image in the center is what's called a line magnifier. So that's a bar magnifier. It also, a lot of them pull light in, and that one has like a highlighter bar. So you can use that highlighter bar. Some of them have a red line, some of them are just clear, to help guide your scanning as you're reading. And then the picture on the right here, that is a magnifier, a stand magnifier that you can have that usually has a light with it too. So then you can adjust where you're putting that over like a larger, like a big book or something that you're trying to see, maybe crafts or doing, a game or something like that too. So with your electronic devices, on nearly all of your electronic devices, you can adjust the level of contrast for text and images. Try various levels, but for most people with visual brain dysfunction, often 100% contrast. The highest level you can get is what's needed. Also, you can adjust the brightness of the text, and that's going to depend on the background. And the best way to determine what's right for the person with Lewy is just to experiment. I wish I could tell you there's a you said it this way and that way, but everybody's a little different. So, last, I want to get into these visual hallucinations and misperceptions. So, a hallucination, just to be clear, is a perception of an object or event when that object or event is not actually present. So, in people with Lewy, they can have all different types of hallucinations that involve hearing or smell or taste or touch, but vision is definitely the most common. And then these can be confused with those illusions that I talked about earlier, where you've got the coat hanging on the coat rack and it looks like a person. That's something's actually there, right? That's kind of looking different. But with a hallucination, a lot of times it'll be well formed. It's a person, it's an animal. I put a baby here because my first patient ever in my life with Louis, when I was a student in my clinicals, saw babies and he would hallucinate that there were babies there. And I thought that would actually be one of the better hallucinations, as long as the baby's not crying. I thought that'd be one of the better ones to see. So, some more simple hallucinations that might not be that well formed animal or, person is a sense of presence. And this can creep people out sometimes, especially family members. So, they might feel like there's just something or someone just over their shoulder. Sometimes they feel like they see someone out of their peripheral vision, and then when they turn, the person's gone. Some people feel a presence of a deceased relative or pet. I actually have a former patient right now that I stay in contact with, and they said that she talks to her husband who's passed like he's right there. And it's kind of creeped some people out, but it doesn't bother her, it doesn't disturb her. It actually seems like it brings her some comfort. Um, Seeing that things pass in the peripheral I talked about, so shapes or shadows or illusions. So these are some of the things that we can see as well. So these misperceptions, I just wanted to kind of note here too that they studied recently patients with DLB and PDD, and they found that those who had complex visual hallucinations, where they're seeing like I had one guy who saw the tax collector in a trench coat, with an envelope under his arm. That seems to correlate with more multi-domain cognitive impairment. So that means they're going to have changes to attention and executive function and memory. So they're going to have more domains impacted. Minor hallucinations, so more of the illusions, kind of those passage hallucinations, the presence, are not correlated with cognitive impairment in any domain. So people can have those changes and not necessarily have the cognitive impairment, especially with Parkinson's disease. So, how do we mitigate these a little bit? Idle hands are the devil's plaything. So, the more someone spends, more time they spend in dim lighting or dark rooms with the television on, no lights on, in the recliner, tends to really trigger these. Sleep is very important. So, having good sleep hygiene, working to keep that proper day and night schedule, and preventing sleep deprivation becomes really important. And then poor vision can also lead to visual hallucination. So, another reason to keep those prescription lenses up to date. So, how do we cope with these? When they're frightening, it's really important to reassure the person that they're safe. Think about moving to a different environment or another room, because a lot of times it may be something that they're seeing in that room. Try increasing the lighting, maybe the visual stimulation, auditory stimulation with like a movie or some music that's enjoyable or activities. That can sometimes help. And there's a lot of non-drug management strategies. It's important to note that we'll get into this, antipsychotics or the drugs that treat hallucinations can be really dangerous sometimes for people with Lewy. So we want to try this stuff first. And if it's not frightening to them, if it's not bothering them, we may want to avoid medicating. So you want to stay calm, don't argue, try to reassure them. Like I said, give those distractions, maybe pull out a task that they like looking at photos of the grandchildren or some kind of activity. Try to keep a consistent daily schedule as much as you can. That really helps to keep the brain in that consistent pattern. Regular exercise and sleep are important. So having some activities like that. And then really looking at how can you keep the environmental stimuli down, like noise or large crowds, trying to keep that minimized because that a lot of times can be triggering. So, how do we support those altered perceptions? Well, we want to, and this is, I don't know if you guys remember when everybody was seeing Mary on everything and Mary was on toast or Jesus was on toast. So, I found a picture online where someone saw Mary on toast. And so, there's an altered perception for you. We want to rule out any physical ailments that might be contributing. So, this could be a UTI, an infection of some sort. Lewy does not go along like this and then crash all of a sudden. It's a slow decline. Anytime you see this and this, you want to check with the doctor. There's probably some kind of an infection going on. And with that being said, they may not need medical intervention if it's not threatening. If there is nothing wrong from a physical standpoint, they're not becoming angry or agitated in any way from it. You might not want to do a medication. Also important to review the medications that might need to be reduced or stopped. So maybe sometimes the Parkinson's medications like carbidopa, levodopa can sometimes increase some of these hallucinations. You want to look at any environmental factors or social factors. Maybe there's, a chair in the corner with a blanket over it that always makes them think there's a monster there. Are there people that maybe come around that maybe are a little triggering, maybe not so pleasant? That's something to consider. Um, Look at these strategies first before you drug. And then think about an antidepressant a lot of times. Talk about that with your doctor. Sometimes that needs to be first line. And then we want to make sure whatever treatment they do, they want to be pretty conservative and monitor closely for severe reactions because some people can really react severely to some of these antipsychotic medications. All right. So, in summary, with that, I'll take some questions. Lewy can impact vision. I think you can see in a whole host of ways from both how our eyes move and see to how it goes into our brain and how we process that. Openly discuss these changes to vision with your healthcare team, with your neurologist, with your eye care provider, with your occupational therapist, and then prioritize visual health and really stay current on eye exams. So important. You have to be flexible and innovative in everything with Louie. You're going to need a whole big, huge toolbox or bag of tricks so that you can really try different strategies, see what works for you at this time or this date, because it can really, really vary. And with that, I've put some additional resources that I'll share out, and they can send these to you guys. We have a great resource at LBD called Visual Function in Louis. We've had some great courses and webinars on this. And so I'm happy to share these out for you as well. And then I wanted to make sure everybody here knows about our support line. So this is not a hotline. We do want our people to sleep, but it is open 8 to 5. And then, you can email, they will call you back or respond to you. It's 1-800-539-9767, or you can email support@lbda.org. And no question is too big or small. Reach out, they'll send you in the right direction and help you get the resources that you need. And with that, I thank you all. Please visit our website at lbda.org, and I'm happy to take questions now.
Oh, thank you so much, Julia, for that wonderful presentation. So informative.
Thank you.
There is one question someone asked, if there is any like downloadable syllabus or handout that could be found like online for this or
I will
yep.
send you that visual function in LBD. That is the best one. Pretty much everything I covered in this presentation is in that booklet. So if I share that with you, Nina, can you share that out with them?
Yes.
See, and I could possibly put the link in the chat here too. Let's see. Oh, yeah, I think I found it here. Cool. And so I'll put the link in the chat if you guys are able to access that. That's great. And then I can also send it to Nina and she can share that out with you guys as well. Any other questions?
Yes, thank you. Okay.
Oh, there's
Let me see if there's anything else. Okay.
It's clear as mud, evidently.
Yes. Well, if you don't have any other questions, then I guess we can just wrap it up for today. I really appreciate, well, we all appreciate this information, and I will send out that link to them so that they, and for anyone else who didn't get a chance to come.
Absolutely. Great. Thank you so much.
Thank
Appreciate it.
you, Julia. Have a great rest of your afternoon.
Absolutely. You guys too. Take care.
Bye.